recruit and retain staff to provide quality care as best that they can with the rates that we have in this area. We have demanded from the state to make health care a priority, and the state seems not to be making health care a priority. The tentative budget that was announced last night by the governor is inadequate to address the health care needs of our community, of our nursing homes, our hospitals, and the state needs to do better. So we're here to say that what has been proposed, what the legislature appears to be ready to vote on, is inadequate for the health care needs of our communities. So I'm going to turn it over to Grace Bogdanoff, Western New York Nursing Home VP for 1199, who is going to introduce our speakers today. Thank you.
Thank you, Todd. So I'd like to introduce Erie County Executive Mark Poloncarz.
Thank you, Grace. Good afternoon, everyone. Welcome to the beautiful Erie County Old County Hall. At one point, this had all of government in our region. Both city and county government was located in this one building. Not anymore, but thank you for joining us here today. Erie County has the ability to look at how much money is spent through Medicaid on an annual basis in our community, through our Office of Medicaid Inspector General's office. More than $2 billion. $2 billion is spent annually with Medicaid in Erie County. And the vast majority of that money is not for a traditional doctor's visit, it's not for a basic surgery, it's for end-of-life and home health care for individuals who are in nursing homes. And we see the numbers grow annually. The numbers are not decreasing with how much is spent on Medicaid annually. It's growing, and as we know, the growth has gone up. But what we haven't seen is the applicable congruent increase in the salaries of the individuals who are providing the services to those individuals who are on Medicaid and need that additional service. We in Erie County see it. We see what New York State is doing. We've been the recipient, unfortunately, of a major cut with regards to additional dollars that are provided to Erie County to help pay for our Medicaid programs. We've been fighting for that, but I'm here to say to each and every one of the members here from SEIU 1199, from CWA and elsewhere, I stand with you. We need to ensure that these individuals who are providing incredible service, incredible care for people who need it, are paid appropriately. You look at what's going on across the country and you see the differences. Unfortunately, that difference is growing in New York. People need to be paid an appropriate salary for the services they're providing. Sometimes the individuals that are standing behind me and the people that they represent are the last faces that an individual will see. The last face they will see after being in a nursing home for maybe a long time. And they want somebody there who cares about them. They want someone there that they know is there working on their behalf. And then we don't pay them appropriate wages. That is wrong. That's why I stand here today and I call our friends in New York State to ensure that those employees, the individuals who provide incredible care to the men and women of our community, are paid an appropriate salary so that each and every one of us can understand if we need to be on Medicaid, and a lot of people, including all of us who are standing here, will probably someday be on Medicaid, because when you get older, it is the primary health care insurance for those over the age of 65. Hopefully we all live to an age of over 65, and if that's the case, we're going to be on Medicaid, and we're going to want to ensure that the individuals who are being paid for the services that are provided by Medicaid are being paid a fair salary so that working families can strive, advance, and become stronger. Thank you, everyone.
Thank you. And next I'd like to introduce New York State Senator Tim Kennedy's Chief of Staff, Adam Vogel.
Thank you very much. Unfortunately, Senator Kennedy got pulled into a leadership meeting with his conference and wasn't able to be here today. But on his behalf, I just wanted to say that Senator Kennedy's been leading the fight for the 20% reimbursement rate. This has been a priority for him. in this budget. We've seen the announcement about what these rates look like they are going to be, which is very disappointing. My message today from the senator is the fight is not over. We cannot stop. We cannot settle. The workers that SEIU represents deserve better. They deserve more, and we're going to continue to fight to make that a reality. I just wanted to recognize County Executive Poloncarz for his leadership of this county and his leadership on this issue. I also want to make sure to recognize our great assembly delegation that we have here today. Assembly members Rivera, McMahon, and Conrad, who have been leading the fight, along with Majority Leader Peoples-Stokes, to make sure that we adequately fund our healthcare system. We need to continue to work. This budget will get passed, but we need to keep moving forward, and we need to keep fighting for what's right, and that's to adequately fund our healthcare system. So thank you very much.
Thank you. And next I'd like to introduce Dr. Turkovich, President of Oshai Children's Hospital.
Thank you, everybody. I really appreciate everybody being here. I appreciate our elected leaders. As they said, I'm Dr. Stephen Turkovich. I'm the President and Chief Medical Officer of Oshai Children's Hospital. You know, and as a father and as a pediatrician, it's truly an honor and privilege to serve the children of Western New York. Unfortunately, as we all know, the medical, social, mental health, and economic challenges facing our community have never been greater, and they continue to grow every single day. I'm going to share some numbers with you which are striking and unfortunately sobering. In the 8 counties of Western New York, 1 in 5 children live in poverty. This represents over 61,000 children who are neighbors, friends, and family members whose health and well-being is directly impacted by the effects of poverty. In Western New York, over 16,000 children have a disability, many of whom rely on the support and services funded directly by Medicaid. As the only children's safety net hospital in Western New York, our team of dedicated healthcare workers care for over 15,000 patients admitted to Oshai Children's Hospital every single year. In addition, we care for over 47,000 visits to our emergency room, almost 100,000 visits to our primary care and specialty clinics, and almost 10,000 visits to our pediatric mental and behavioral health center. Unfortunately, the healthcare industry continues to face the financial headwinds following the COVID-19 pandemic. Governor Hochul and our Western New York legislative delegation have recognized these financial hardships across the healthcare sector, and they understand we need help. Last fall, the governor made a $25 million commitment to Oshai, as well as an historic investment in the healthcare industry. We applaud the governor for her commitment to mental health and to this $25 million support in the past. We're appreciative of the state's support, but so much more needs to be done to address the ever-changing healthcare needs of children and families in our community. At Oshai Children's Hospital, 60 to 70% of our patients receive health insurance directly through Medicaid. In our primary care centers and our women's health centers, that number is over 90%. Although New York State has one of the lowest rates of uninsured children, Medicaid funds only 61 cents of every dollar spent to care for a patient who receives Medicaid. This is simply not sustainable. We need a robust and a sustained funding plan to ensure that we can collectively and effectively address the social determinants of health for our community's kids and families. When only 61% of every dollar spent is reimbursed for over 70% of our patients, it's nearly impossible to invest in the resources needed to support our children and ultimately help them grow and thrive and reach their full potential. Medicaid reimbursement rates have remained largely flat since 2008. With an average annual inflation rate of 2.5%, expenses are almost 40% higher now than they were in 2008. Raising Medicaid reimbursement rates by 6 to 7% fills only a very small portion of this gap. Simply put, this is unacceptable, unsustainable, and woefully inadequate. When are we going to stop underinvesting in children and families' well-being? We need support to hire more social workers, more therapists, more mental health specialists, community health workers, and care coordinators to address and eliminate the socioeconomic disparities that were amplified during the pandemic. We need support to ensure we have enough nurses, enough MAs to care for the sickest and the most vulnerable children who are admitted to the hospital and seek care in our ambulatory centers. We must ensure that our critical child and family healthcare system is strong, sustainable, and ready to serve our community when the next RSV surge or new COVID variant hits our most vulnerable the hardest. The Western New York Legislative Delegation continues to advocate for additional funding for distressed hospitals, particularly those in our region, and we thank them for their commitment and their support. We know that investing in children's health and well-being builds a stronger community. These investments keep children in schools, strengthen and grow our workforce, and grows our economy, creates healthier adults, provides a path out of poverty, and simply is the right thing to do. In closing, we thank you and we stand ready to partner to protect investments in healthcare across and access for kids within Western New York. There should be no debate. Our children, our families, and our community deserve the highest quality healthcare, fully staffed with a team to provide holistic and comprehensive care. Thank you.
And next I'd like to introduce Debbie Hayes, Area Director of CWA District 1.
Thank you, everybody. I'm here to speak today on behalf of CWA and the members that we represent working in our healthcare industry. We have a healthcare system in our state and in our community that is under duress. Our facilities are struggling financially. We're struggling to provide at the bedside in our facilities the care that our patients deserve. This whole budget discussion for CWA and our members was about helping to support struggling facilities, because we know that in supporting struggling facilities, our members will get the resources that they need to provide care. And when I talk about the provision of care, it doesn't matter if it's nurses at the bedside, folks in our labs and imaging units, folks that are preparing the meals or cleaning the facilities. There are not enough of us to care for the patients that we have under our care. I have to say that I was so disappointed when I saw the tentative budget deal, because I feel like commitments that we received from the governor to look at the healthcare system in our state have not been met. And we will continue to struggle over the next year to provide the care our patients deserve. And I think in closing, that's what I will say. The struggle is not over. We've been fighting for a long time. We will continue to fight on behalf of our patients and the people we represent in all of our facilities. Thank you.
Next I'd like to introduce Dawn Hirsch, Director of Corporate Communications with the McGuire Group.
Thank you very much, Grace. As she said, I'm Dawn Hirsch. I'm the Director of Corporate Communications for 18 skilled nursing and rehab facilities in New York State, most notably the McGuire Group and Absolute Care here in the Buffalo region. I stand here today with my colleagues and industry professionals to reiterate our concerns regarding the perilous situation facing New York State nursing homes. As we all know, the current Medicaid reimbursement system is unsustainable. The reality is more than 70% of all resident nursing home days are paid for by Medicaid. The current reimbursement rates are woefully inadequate to cover the true costs of care. In fact, New York State has one of the largest Medicaid shortfalls in the country, in some cases up to $80 per day per resident. It's been 15 years since the base Medicaid rate has increased, while the cost to operate efficient, high-quality facilities has increased exponentially during that time, especially during the COVID pandemic. Nursing home operating expenses, including wages, benefits, facility improvements, supplies, food, and more, has increased 23% between 2017 and 2021, while reimbursement remained flat. Nursing homes have been calling for a 20% increase to address inflationary costs, implement sustainable workforce development programs, and enhance essential care initiatives to ensure the residents of the McGuire Group, Absolute Care, and the 600 other nursing facilities in New York State get the quality care they have earned and deserve. Just to give you a little more perspective, in light of the financial and operational challenges facing nursing homes, Bonadio and Company, one of New York State's largest accounting firms, has shared preliminary financial results from an audit they're conducting. These numbers give a snapshot of the financial performance of 140 nursing homes in New York State. The preliminary financial results for 73 of the facilities show staggering losses for the year ending 2022. 87.8% of the homes reported a negative operating margin. The combined net loss of all 73 homes was $160 million. The average loss per facility was $2.2 million, and the median loss per bed was just under $10,000, meaning a 160-bed facility lost $1.6 million. Now is the time to adequately and appropriately reverse the uncertainty that faces New York State's nursing homes, hospitals, and healthcare institutions. Nursing homes are a vital step in the continuum of care and have changed drastically over the last 25 years. We now care for sicker and more acute patients and offer services including ventilator care, telemetry, dementia, dialysis, wound care, and more. However, years of inadequate reimbursement rates are leading to fewer skilled nursing beds, which leads to problems along this continuum of care. This bedlocks hospitals and causes patients to stay longer than expected or necessary. It also causes the potential for people to be denied appropriate levels of care when they need it the most. I stand here today amongst legends caring for legends. There's no words to describe the amount of respect I have for our frontline caregivers. They're the ones who show up and step up when they're needed the most. They're the ones who care for our sick and vulnerable. They are the quintessential example of heroes, and they carry this industry on their backs. It's imperative that we fully recognize the true cost of providing this level of care and adequately support the facilities that do so. Thank you.
Next, I'd like to introduce Senator Sean Ryan.
Sometimes problems aren't clear and sometimes solutions are nuanced. It makes it hard to figure things out. But in this case, the problem is crystal clear and the answer and the solution is not nuanced. Right now, we're expecting our Western New York nursing homes and hospitals to provide patient care, but we're not paying them for that. So if a Medicaid recipient comes into a hospital or a nursing home and something costs $100, we're saying here's $70. Well, that's a $30 short charge. You might be able to do that once, but you can't run a healthcare system or nursing home systems on not paying for what you're expecting to be delivered to the patient, and that's the problem. So we're expecting healthcare systems and nursing homes to work some sort of accounting magic. You might be able to continue that for a year or another year, but suddenly your reserve account's gone and you can't keep functioning. You know who agrees with me on this? Every union worker who works at a hospital or a nursing home, administrators from the hospitals, be it Catholic Health, ECMC, Galida, we all get it. Nursing home operators, private and nonprofit. There is no dispute of what's happening here. We are consistently shortchanging our healthcare system and our nursing home system, and we have to end it. So right now, we're coming close to the end of the budget. But what's proposed is not going to solve this problem. It's going to perpetuate this problem, and it's going to make it so you cannot provide care to the people you are supposed to care for. When people we love go into hospitals, go to nursing homes, we want to have the faith that the good people who are running those organizations and are working at those organizations can take care of our loved ones. But if you pull them aside and you ask them, is my loved one going to be here? And they're going to be okay. They're going to tell you, you maybe ought to stick around a little bit longer because we don't have enough staff right now to take care of people. So we have to solve this problem. We are close to the end of the budget. The ink is not dry, but we need to increase the reimbursement rate if we expect stable nursing homes, if we expect stable hospital systems. If we don't make this change, we're going to have hospital systems continued to be in distress and nursing home operators who say, I can't make it. So we're going to continue fighting. We're going to do it all together. Thanks for having me here today.
Next, I'd like to introduce Sean Reed, a certified nurse's aide at the McGuire Group's Garden Gate.
Sean Reed, McGuire Group, been here 6 years, 7 as a CNA. I just want to say that during the time of COVID, we were there. Beginning, some of us are still there. We don't get. I think we need help. Residents need help. We need help, and the way we can do that is by increasing the budget. All right, thank you.
And last, I'd like to introduce Peter DeJesus, President of the Western New York Area Labor Federation.
Thank you, Grace. Thank you, everyone, for joining us today. I wish I could say it was nice to be here with everyone today, but we know the reality of what's coming down the road. We know what we fought for. We know what's being proposed is woefully inadequate. It does nothing to help our healthcare institutions and the healthcare heroes who, for the past 2.5+ years, have gone above and beyond the call. Every budget cycle offers us an opportunity, a choice. And unfortunately, in our eyes, and what we know, that choice that was made, that is being proposed, is the wrong one. Hospital and nursing homes are emerging from the pandemic significantly weakened. Flat reimbursement rates combined with soaring costs are jeopardizing our ability to continue to provide the care the community needs. Based off the proposed tentative agreement, we know that Medicaid now only pays 63 cents for every dollar of costs, creating a financial crisis at any provider serving our state's most vulnerable. After decades of being a leader in providing high-quality health care to low-income residents, New York now has the nation's worst payment adequacies and is harming patient access. While the tentative budget agreement reverses the worst, I want to echo that, reverses the worst of what the governor has proposed, it does not begin to address the problem. $500 million in funding is only a fraction of what is needed for our safety net hospitals throughout the state, including the offsets cuts. A 7.5% Medicaid rate increase for hospitals is only 2.5% in new funding. This proposed agreement does not come close to closing the Medicaid gap and restoring stability to our healthcare systems. Both hospitals and nursing homes are facing increases in costs far higher than what is provided in this agreement. The governor's refusal to recognize the scope of the crisis will have real consequences here in New York State and in Western New York in particular. We thank our legislators, many who have joined us here today, for continuing to fight hard for the health care that we need in this budget. We are angry and worried that the consequences of the governor's refusal to respond to their demands will adversely affect the most vulnerable in our community and our ability to provide the quality care that we know we can do. So as union members, we will continue to speak out and raise the alarm when our communities do not receive the care they need. And as Debbie Hayes, Area Director for CWA, stated, we will continue to fight because we must. We will continue to fight because our community depends on it. We'll continue to fight because we have no other choice if we are to continue to move this great state forward. So I thank you all for joining us today. I want to thank our siblings in the labor movement, CWA, PEF, NISNA, for joining us, our elected officials for standing with us and continuing to fight in this budget, many times amongst deaf ears. It is an unfortunate day here in New York State. We had an opportunity to really change a vision when it came to healthcare and how it's provided in the state, and we chose the alternative path. So we have work to do. Let us remember that though this is a battle, the war is far from being over, and we need to make sure that we continue to advocate for our patients, continue to let their voices be heard. We will do that in solidarity amongst each other, and we will continue to work with our partners in the political realm. Thank you very much for joining us.